I'm Josh Broder. I'm an Associate Professor of Emergency Medicine at Duke University Medical Center, and I'm the author and editor of Diagnostic Imaging for the Emergency Physician, which is a new textbook from Elsevier. Sure, I grew up in a small town in North Carolina, and my mentors were my father, who is a radiologist in a community hospital, and my mother, who's a human geneticist. And they interested me early on in science and medicine. I went on to study biology at Duke University, and I did medical school at Yale, and ultimately trained in emergency medicine at the medical center in Baltimore, University of Maryland Shock Trauma Center. Emergency medicine, for anyone who's been involved in it, knows that it's an exciting field because of its incredible diversity. We have the diagnostic challenge of taking the undifferentiated patient with complaints from chest pain, headache, trauma, infectious disease, altered mental status. We see patients from every age, from birth until very advanced age. We take care of anyone, anytime, anywhere. So it's a field that lends itself to a very diverse textbook addressing all the litany of complaints that patients may have and the different presentations that they may have. Diagnostic imaging is really key to so many different things in emergency medicine today, and because of that I became interested in it early in my career. My book covers the approach to diagnostic imaging in a head-to-foot approach, following the types of chief complaints that a patient may present with. The book spans every part of the decision-making process, from who needs imaging in the first place to which imaging tests are best to differentiate the conditions that may be present. It also goes through the best ways to interpret images in an efficient way, looking for key findings that could change immediate practice and immediate patient management. And we delve into the evidence for different imaging modalities, different strategies, clinical decision rules, in an attempt to be efficient in our use of diagnostic imaging. We need to be attentive to radiation risks today, and a big part of the focus of the book is minimizing radiation risks while making the correct diagnosis in a timely fashion. This book is really written from the perspective of a practicing emergency physician, and that's me. I'm not a radiologist, although I bring a lot to the table in terms of understanding and analyzing the radiology literature, but it's designed for a practicing emergency physician. The thought process behind the worst first diagnostic approach, and in addition it's a book that's tailored to the time-sensitive needs of the emergency physician, that we need to be able to look at an imaging study and in seconds or in just a moment recognize critical findings that might change the course of a patient from medical management to surgical management, or have other immediate impact on the patient's care. The images in the book are really the highlight of the text. I spent over 3 years selecting images for the book from my own practice. Every image in the book is meticulously labeled so that the picture tells the story, and I didn't put a single image in the book that I couldn't understand myself as an emergency physician. I was tired of reading books and looking at images and being unable to decipher what the arrow was pointing at. I think that the learning in this book is focused around the images which highlight the pathology. Obviously the world is becoming more and more an electronic and mobile place, and Elsevier has put the text both into a print edition and also an electronic edition that makes it accessible to emergency physicians practicing anywhere in the world where they have internet access. Some of the trends that we're seeing in emergency medicine are increasing use of high technology imaging modalities. Those include CT scan, MR, and ultrasound. One of the problems, of course, that comes with increasing utilization is increasing radiation exposure. There's a national understanding now that there's going to be an epidemic of potential cancers induced from our increasing use of diagnostic imaging, and so there's a fine balance to be struck between the immediate needs of the patient presenting to an emergency department against the future population risks of cancer. So we're pretty attentive to that in this text. I think that the book is really tailored for learners at every level, from medical students who may not yet have selected a field to specialize in, to practicing emergency physicians who've been out for a number of years from their training programs and maybe less familiar with advanced imaging modalities such as CT, and of course residents in training today who are versed in modern imaging techniques. I try to accommodate the needs of all of those different learners in different ways by addressing indications for imaging and efficient algorithms for interpreting images ourselves. I think many people went through their training reliant on the radiologist to render an interpretation of a CT scan. Emergency physicians for many years have been very capable of reading diagnostic imaging, plain radiographs, but today's emergency physician really needs to be capable of looking at a head CT, a chest CT, abdominal CT, even MRI, and recognize findings that require urgent action. Elsevier approached me for the book, and I was very excited at the prospect. It's such a well-respected name in medical publishing, and they've worked closely with me over the 4 years that we've developed the book to make sure that it's really tailored to the needs of emergency physicians. They worked also very closely with me to make sure that the quality of the images would be where it needed to be, to make sure that the findings, some of which are quite subtle, really come through to the reader.